to the power of one. Today, I'm going to be speaking with Dr. Matthews, who I think he's retired, but until meeting me, he's not retired, but I guess once you're always a wonderful physician, you'll always be a wonderful physician. Welcome
Thank
to the show, Dr. Matthews.
thank you. Thank you for inviting me.
You're welcome. Dr. Matthews, please tell the viewers a little bit about yourself and your background.
I am a family physician. I trained actually at Abington Hospital, and after that, opened a private practice over in Glenside in a small office and practiced for about 10 years by myself before a partner joined me, and we practiced together for a few more years, and then Abington Hospital bullied us into joining their network of physicians, and so we became part of the Abington Physician Network, and then Abington got bullied into becoming part of Jefferson. So my last few years, and the practice was growing immensely, and so we ended up actually with four physicians and about 20 employees, and we became part of the Jefferson Health Network. At the same time, I began in 1986 and 89, actually. I took the role as chairman of the Department of Family Medicine, excuse me, at Abington Hospital, and I kept that until 2019. So I was chairman of the department for 33 years. So
Wow.
yes,
Wow.
we had a department of 35 or 40 physicians who practiced in the community and at Abington Hospital.
Okay. Now, do you sit on the Martin Luther King committee at
Yes, I do.
Abington?
Yes, I do.
Okay. All right. Doing
And
amazing
I've
things.
I've I've also been on the board uh, on the board at Abington for 20 plus years, and I sat for quite a while on the board at Jefferson when we first started our affiliation with Jefferson.
Wonderful, wonderful things. So tell me, why is it so important for people to get annual physicals?
Well, I think that that is a term that needs to go in the wastebasket.
Okay.
I think that what is important is an annual health visit.
Okay.
And it is important for a number of reasons. The exam actually is a very small part of that. I think that, and we called it a preventive health maintenance or preventive health, and that really is the backbone of primary care. Um, we start with vital signs, blood pressure, weight, pulse, waist, uh, ideal body weight, and vision and hearing in kids. And we had a significant number of kids. So that's sort of a start. I used to give a talk when I went out and talked. I used to give a talk that said, know your numbers. I used to encourage people to make sure that they knew their ideal body weight, their blood pressure, their cholesterol levels, their waist size. And waist size is not insignificant because the data suggests that males with a waist over 40 and females with a waist over 35 statistically live 10 years less than the normal population. So waist is really a one way of measuring truncal obesity, and so waist is part of that. So
Let me ask the question.
yes.
Is that a one size fits all? Because, like, my African American females, I can speak to this, we are built different than other races. You know what I mean? So is it a one size fits all?
That's always been a debate, and the issue of ideal body weight is always a debate. But the waist figures have held true. So
Okay.
yeah, that's a one size fits all. Women with a waist over 45 and males with a waist over, I'm sorry, 35 and males with a waist over 40 statistically live 10 years less than the normal population. So that's a lesser part of the annual preventive health maintenance. Um, the more important parts are to determine, first of all, what are the health risks for the patient, and they run anywhere from and they should be listed as diagnoses on the chart and addressed. And they include obesity and cigarette smoking and fall risk at home, unhealthy lifestyles, whether the person exercises, how well they sleep, how much water they drink, and uh, medication compliance, food insecurity, which is another bigger issue now that we're recognizing some of the social determinants of healthcare. These are all parts of this annual exam. One of the things that has just come up, and I'm not sure it's clearly defined yet, but we had a very prominent actor, Gene Hackman, who was found dead at home, and the answer hasn't been fully determined yet. But one of the things that we had just started looking at is CO2 put out by your heating system. Is there carbon dioxide to put out when you turn on the heat and have the windows closed? And there are people who die from CO2 poisoning. So we were suggesting that people have some kind of home CO2 monitor. I had it when I had my house in order to give you an alarm if there's too much carbon monoxide or any kind of explosive gas. So these are all health risks that I think need to be addressed during the annual physical. We can't address them all and change those things, but these are things that I think need to be addressed. Another big thing, although the automobile manufacturers have helped us, is seat belts. Do people wear seat belts? And
Mhm.
have that recorded in the chart to determine whether or not they are doing things that are healthy for them, okay, or
Mhm.
non-healthy for them. Uh, the next thing, again, we're keeping with the concept of an annual health maintenance exam is immunizations. Very important, extremely important. For adults right now, it's RSV, respiratory syncytial virus, it's flu, it's pneumonia vaccine, and of course, tetanus. I just read this morning in the Inquirer, and of course, we've known that the peak flu season in the Delaware Valley is January 15th to February 15th. And last month there were 23,000 cases of flu. And so it's important to find and record and make sure that people keep up with their immunizations. And then, of course, as I said, we had a lot of kids, and so there's any number of vaccines that the kids need to be caught up on to make sure that they are healthy. Vaccines come under fire by a number of people, a number of anti-vaxxers. But I like to remind people there is no smallpox in the world, and that has been eradicated by the smallpox vaccine. There's almost no polio in the world. That's been eradicated. There's a small population up in the Amish community that refuses to get vaccines, and there is polio being seen there. And now we're getting to see some measles. And
I saw that. Yeah.
so far as I've read, almost all of the cases of measles are in people who are not immunized.
Mhm.
So it's tough for me to understand the anti-vaxxers when we have clear data that the vaccines have eradicated and cut down a significant number of illnesses. RSV is one that is relatively new. We used to think it was only in kids, and there are 100 to 500 pediatric deaths a year from
Mhm.
RSV. But what we're seeing is there's about 14 or 15,000 adult deaths from RSV.
Mhm.
So adults should have RSV vaccine.
And I don't think people know that. And like going back to COVID, so for many of us, we thought COVID was new. And in actuality, it wasn't new. And correct me if I'm wrong. We thought it was new. And then once they came out with this vaccine, and then it was like, oh, people were like, oh, they just rushed this vaccine. We don't know what's in it. And then when the news would just talk about the Johnson & Johnson vaccine, which actually killed a few people. It was probably millions and millions and millions of people who took the vaccine. But of course, the news did their job in saying this person died and this person died. And that sticks out in people's minds. I think, and I don't know, that's probably what
Yeah,
happened.
it's
And speaking to another doctor, Dr. Harris from Einstein Jefferson, she was saying that such a shame that there was a lot of African Americans that just would not get the COVID vaccine.
yeah, I think that it's very sad. There's so much mistrust and distrust, and believe me, African Americans have a lot of reason to distrust the medical system. But on the other hand, I like to go with the statistics. I mean, we can go back to Tuskegee experiment and all those kinds of reasons that African Americans don't trust the system. And of course, the pharmaceutical industry is really in it for the money. And so I understand, but the data carries its own weight. The data says that we need these immunizations. The immunizations save lives. So I'm a big uh, person for immunizations. Um, Not to take up all the time with your first question, but part of this, our next part of the annual health maintenance exam is discussion of cancer screening. And
Mm-hmm.
the major cancers we screen for are breast,
Mm-hmm.
prostate,
Mm-hmm.
colorectal, and cervical. And there's something to be said for all those. Obviously, breast. We had an unfortunate case recently of uh, 20-year-old who had a mammogram, and then she came back to the office about 6 or 8 times over the next 3 or 4 years, and there was no mention of the mammogram. She never had the mammogram. And then 4 years later, she came back and she was being seen by another doctor. This was not my practice, it's a practice I teach at. And she
Mm-hmm.
came back and saw another doctor, and she had metastatic breast disease. Now, that's unusual. She's 24 years old, but had somebody been close enough to say, okay, you didn't have the mammogram, uh,
Mm-hmm.
might have kept her from doing that. So breast cancer, prostate is a big issue, and there are several recommending bodies that recommend prostate screening. And the urologists take one position. The USPSTF, United States Preventive Services Task Force, has another. Uh, and many people recommend that it should be informed decision making. You need to talk to your doctor and decide with them, is there a family history of prostate cancer? Should I have the PSA? The problem with that is a lot of people have had biopsies, have had surgery, and they had minimal or no cancer, and a lot of downside from having been screened and having this found. So, the screening's not always the best answer for everybody, and it's got to be informed decision making. So I think everybody should have a primary care doc and discuss these things and decide what is the best risk for me. What do I do? Colorectal cancer. For years, we've been doing colonoscopy at age 50, and just in the last 5 years, the recommending bodies changed that to 45 because colon cancer screening is being found now in a younger age population, and the American Cancer Society has already given an indication that in the next couple of years they're going to change that recommendation to age 40
Mm-hmm.
because we're seeing colon cancer in the younger population. Colonoscopy is not fun to have, but it's a relatively easy test other than the prep. You find something, you take it out, and you're done. You don't find it, and that person ends up dying from colon cancer. So,
Yeah, but it's so scary though. And I'm just going to speak from experience. It's just so scary. Like having all of these tests done is just people are scared. You know what I mean? I'm scared. So and I get it done. I get
well,
my mammogram, my yearly physical done. I didn't get the colonoscopy yet. I have to be honest, but I'm just so scared. Like you just don't. You know what, Doc? Cancer is ridiculous. You could live a healthy lifestyle and still get cancer.
that's exactly right.
Boggles my
That's
mind.
exactly right. we don't have the capacity to prevent these things. And so therefore, that's why we should find it early. I've had two colonoscopies, and then because of my age now, when it was time for my third test, and that's every 10 years in someone that doesn't have a family history, I was able to give a specimen and have it tested. Um, the thing that I was most concerned about was the anesthesia, because I had never had anesthesia, never had any surgery or anything. But a colonoscopy is a test that saves so many lives. There's no reason really why anybody should not have a colonoscopy. In my 40 plus years of practice, I know of two people that had an adverse reaction to the colonoscopy,
Mm.
as opposed to the number of people that were saved by finding a polyp that would later on become cancerous. Extremely, extremely worthwhile. Um, let me talk about cervical. Let me talk about cervical cancer because the Pap smear for years has stood the test of time, and that's what we've always done to try to determine whether or not a woman has propensity for cervical cancer. It has been shown that a significant percentage of cervical cancer is due to HPV, human papillomavirus. And we have the vaccine now that everybody should be starting to get at an earlier age. And there's always mistrust and a concern about that. And I hear some parents who even think, well, if I give the vaccine, then my daughter, that means that she's okay to have sex. No, that means we're going to keep her in her later life from having cervical cancer. And as a matter of fact, now the relationship has become so cemented that several of the bodies recommend a pap smear between age 20 and age 30. And after that, only HPV screening.
Mm.
And we used to joke about it all the time, but there is a company that is providing an at-home pap smear HPV test so that women can do this at home. Okay.
Okay.
So HPV and cervical cancer, you have to do the research and look at the data and think about that, you know. It's just
Mhm.
so important. So those are the cancers: breast, prostate, colorectal, and cervical. Um, there's more stuff coming, I think, but for right now, those are the cancers that we screen for. Just a couple more things because I've already taken up a long time. This visit takes a long time, but it should because
Right.
it's a health maintenance visit. Osteoporosis screening.
Mhm.
It is highly recommended by several of the bodies. And when I say bodies, I mean organizations that write the recommendations that women over age 65 have osteoporosis screening. The osteoporosis medicines are not great, but if you find somebody with osteoporosis, if you treat it, keep in mind that 65% of women who break a hip never walk right again.
Mm.
Never walk right again. So if we can find out who's at risk for osteoporosis and treat it if necessary, it's worthwhile to do the screening. Now, a lot of what I'm saying kind of reflects back to some of the other things I said when I'm talking about healthy lifestyles, exercise. I'm going to come back and tell you what my recommendations for exercise are, but exercise really plays a big role in keeping those bones hardened. I wish I had an answer for males with osteoporosis because males do get osteoporosis, but none of the recommending bodies has a good guideline for males because there's not good data on males. So
Mm.
you're not screening males for osteoporosis as it stands. There is a recommendation for smokers over the age of 75 who smoked 20 pack years or more to have a CAT scan of their aorta because there's a higher risk of aortic aneurysm. So
Mm.
you need to look at whoever I've got in the office if they have that. And of course, they've been listening to me for the last 40 years to stop that smoking. But if they are a smoker, 20 pack year history, and they're over 75, somewhere along the way, I'm going to say, go get a CAT scan because I don't want you to have an aneurysm. If you have an
Mhm.
aneurysm that explodes, then I'll be talking about what a nice guy you used to be. So
Mhm.
we really need to address that. And finally, not finally, I mean, I could talk for another hour on various things, but mental health screening is important.
Mm.
Now, there's good discussion and debate about whether mental health screening is really beneficial. But in the sense that suicides continue to occur, you need
Mhm.
to decide who are my at-risk people.
Mhm.
I just found out about a family member who is not very happy in her employment, not very happy in her marriage, and so I'm trying to mobilize my family to address that because I think that she is higher risk for suicide. And I think that we need to address that. And there are a number of screening tools, and sometimes we send it to the person to fill out this paper before they come in for the exam to answer some questions. So we have a clue on whether or not they are at risk for some mental health problems or suicide. Through it all, I think that one of the things that I try to keep in mind is the big killers. What are the big killers that cause death and disability? And we are all very afraid of cancer, but most
Mhm.
Americans die from heart attack and stroke. And so that means cigarette smoking, high cholesterol, high blood pressure, diabetes. Those are the big killers. We're afraid of cancer, but people die from heart attack and stroke more than anything else. So those are the things that if we're really going to do the public a good service, we want to try to mitigate those kinds of risk factors to make people live longer. That's a long answer to your question. I'm sorry, but you know that's why I don't like to call it a
Mhm.
physical exam because most of that is not physical. It is reviewing your health status and addressing what you need to do to be continue healthy, continue to have a healthy life, and enjoy your family and career.
Now, before we wrap it up, Dr. Matthews, what exercise regimen would you recommend?
One that you like.
Yeah, eating buffalo wings and
That's
French
not
fries.
exercise. No, that's
Oh,
not
I
exercise.
was, I'm okay. That's about my heart. Okay, yeah. What would you recommend?
The diabetics have really given us some good guidelines on what is a good recommendation for most of the population. And it is recommended 150 to 300 minutes a week of vigorous exercise. So that's what, 2.5 to 5 hours of vigorous exercise. I say it's got to be something you like because if it's an exercise you don't like, you will find excuses to not do it. And so
Sure.
it's got to be something you look forward to, something you look forward to coming home and getting in your exercise gear and doing it because you like it, because it makes you feel good. Is key. Sleep is
Mhm.
key. And I know people who say, oh, I get by on 3 or 4 hours. Most people really need 6 or 7 hours of sleep in order to be prepared. And I'm a big water drinker. And I know
Mhm.
people who say, I don't like water. The data says we need to be drinking 48 to 64 hours of 64 ounces of water a day to keep those kidneys flushed out. And they say, well, it makes me go to the bathroom. That means your kidneys are working. So we
Yeah.
really need to exercise. We need to drink fluids. We need to work on our ideal body weight. And those, as I said, there's a lot of controversy on whether or not those tables are acceptable for African Americans. But you know that, excuse me, somebody who's 300 pounds, whether you're African American or not,
Right.
that is
Right.
not
True.
acceptable.
True.
Okay.
Yes. Yes.
And so we have such an obese society. We need to think about how much we eat, how much fried food, and I haven't even addressed the cholesterol issue. I mean, you know, there's a number of medications that have been very successful, and lowering the cholesterol lowers your risk of heart attack and stroke.
Mm.
And so. So there's a lot to be involved in the annual health maintenance exam. I don't use the term physical exam.
Okay.
Yeah, but there's a lot to be
Definitely.
addressed, and I think that patients should have someone they're comfortable with,
Hmm.
someone they have access to, because that's a big problem. If I can't get through on their phone system, they're no good to me. Somebody that I can trust and somebody that I can feel comfortable saying, I don't like that. Let's talk
Hmm.
about it. Give me something different. I mean, I'm a down to earth person. I like to talk with people, and not everybody agrees with what I say. Then let's figure out another way. The bottom line is I want to keep you from having a heart attack and stroke, and I want to screen you for cancer. So
That's awesome.
so
Well,
we,
I thank you so much for joining me today, and thank you for breaking everything down for us so that we understand it.
well, I hope that will do some good. Thank you.
We have to remember that we have to get our full body maintenance. And I like that Dr. Matthews spoke about everything. So we want a doctor that's going to take care of us from head to toe, especially the mental health piece, which is so important. But remember to go get your full body maintenance and get all of your screenings because we want you to be around for a long time. And don't forget to get vaccinated. Peace and love.